our series this entire week will be focused on the challenges we face in Cleveland in our work to achieve a more equitable and inclusive community. And to that end, we're thrilled to welcome two leaders from Metro Health's Institute of H.O.P.E. H.O.P.E is a fabulous acronym standing for Health, Opportunity, Partnership, and Empowerment. And what it does is it focuses on fixing those root causes of health problems by removing the barriers, engaging community partners so that people can access the help that they need so that they can grow, succeed, and be healthier. So let me first welcome Susan Fuehrer. Susan is a proud member of the Leadership Cleveland class of 2008 and currently serves as president of the Institute of H.O.P.E, where she's approaching her one-year anniversary. Congratulations, Sue.
Thank you.
Prior to joining Metro Health, she has a long and highly successful career in the Veterans Administration of Northeast Ohio healthcare system. For you young folks on the call, note that she began her work there as an unpaid intern and concluded her career as CEO, a role in which she served for a decade. There, the VA had significant accomplishments in patient care, in cutting-edge research, as well as education. In 2019, she was the recipient of the Presidential Rank Award. This is given to outstanding leaders who achieve results and consistently demonstrate strength, integrity, and a relentless commitment to excellence in public service. And it is the highest honor that is given to federal civil service executives. Congratulations on that, Sue. And then we also want to welcome Dr. Jim Misak, who is medical director of the Institute of H.O.P.E. In addition to that role, he is vice chair of community and population health at the Metro Health System in the Department of Family Medicine. And he is co-director of the Metro Health System Population in Health Innovation Institute and the physician lead for quality initiatives in the Institute. You're a busy man. Dr. Misak additionally serves as assistant professor of family medicine at the Case Western Reserve University School of Medicine. And in his family medical practice, he serves the population at the Thomas McCafferty Health Center, which is on the near west side of Cleveland. Sue and Jim, we're thrilled to have you. Oh, and forgive me, Jim is a member of Leadership Cleveland 2020. How dare I forget that. We're thrilled to have you with us today, and thank you for the conversation.
Well, good afternoon, everyone, and thank you for joining us. And special thank you to my Leadership Cleveland 2020 classmates who are taking the time out of their busy day to listen in. And thank you, Marianne, for that kind introduction. I'm glad to say now that I am now practicing at the new Metro Health Ohio City Health Center, which is on the campus of Urban Community School at West 48th and Lorraine on Cleveland's near west side. It is a stunningly beautiful building, and I invite people to drop by and pay us a visit if you're interested. So I think everybody on this call knows that Metro Health is the public hospital and healthcare system for Cuyahoga County. We've been in existence for over 180 years, and I think that addressing social determinants of health is in our DNA, although the language we use to describe it is relatively new. It's quite clear that when it comes to people's health and well-being, the health care they receive is a necessary but not sufficient condition to achieve good health. And I think this slide sort of categorizes all of the things that impact the health of individuals and communities. And you'll see on the far right, the healthcare system certainly has a role to play, and I would say a necessary role, but by no means is it sufficient or complete to provide good health to our communities. And on the next slide, you'll see how we think about how these factors influence the health of our patients and our communities. There's a saying in my world that when it comes to your health and longevity, your zip code matters more than your genetic code. There's a 23-year difference in life expectancy. Two neighborhoods just a couple miles apart in Cleveland, in one of the suburbs, if you look at life expectancy, there's a 23-year difference. Obviously, it's not because those neighborhoods are 2 miles apart. It's about what's happening within those communities. And you can see that the things that impact health have a great deal to do with where people live, the conditions they live, and what they've inherited. And I think as we talk now about systemic racism, when we look at systemic racism, it reflects itself through health disparities. If I can have the next slide. One way to try and quantify how these factors influence the health of our communities is through a methodology called county health rankings, and I put the web address up at the top of the slide. This is a site that takes a state, takes the counties in the state, and ranks them by both the outcomes, health outcomes in the county, as well as the factors that contribute to health in the county. And you'll see in the 2020 rankings, Cuyahoga County doesn't do so well. We are 75th in health outcomes and 70th in health factors. And these numbers have been dropping over the past few years. You can see also on the right-hand side that even though we rank very high in clinical care, nonetheless our health outcomes and the factors that contribute to good health are not very good in Cuyahoga County. Again, reinforcing the role that non-clinical factors play in the health of our communities. And I would invite you to take a look at this website. I think it's fascinating. If I could have the next slide, please. One of the ways that racial disparities in health and healthcare have manifested themselves is through the COVID-19 epidemic. What you're looking at here is a slide from the Cuyahoga County Board of Health. This is the Board of Health for Cuyahoga County, excluding the city of Cleveland. The city of Cleveland has its own Department of Health. And you can see in this slide, if you look at the intensive care unit admissions for COVID-19, which are obviously the most seriously ill people from COVID-19, almost half of those admissions are African American. And African Americans only represent about 21% of the population of Cuyahoga County outside of the city of Cleveland. So you can see how dramatically overrepresented African Americans are in the severity of COVID-19 illness. The same pattern occurs both for the incidence of illness as well as the incidence of hospitalizations, and this is a nationwide pattern. This is not at all unique to Cuyahoga County. But I think COVID-19 has really cast into very stark relief how systemic racism manifests itself through poor health outcomes, and COVID-19 is sort of the lightning bolt that illuminates that particular horizon. If I could have the next slide, please. This is a quote from a recent New York Times editorial. These COVID-19 related deaths and hospitalizations occurred primarily during a time of lockdown. So what's going to happen now as we reopen our economy? People of color are much less likely to be able to work remotely. They are overrepresented in jobs that are considered essential. Their means of transportation, they're often more dependent on public transportation. They often live in multi-generational households. It's these disparities that we see in COVID-19 in particular could become much worse over the next few weeks and months. Next slide, please. I think one of the things the Times is calling us to do is, can we reimagine how systemic racism could be addressed, mitigated, and defeated? How can we reimagine that in the areas we inhabit? Obviously, the demonstrations are asking us to reimagine that in terms of policing and public safety. But when we think about health, how can we reimagine a community where disparities don't have such a profound impact on the health and well-being of our communities? And what can we, as a healthcare institution, do to help create that new reality? Again, next slide, please. About a year ago, Metro Health stood up the Institute for H.O.P.E. As Mary Ann mentioned, it's an acronym. It stands for Health, Opportunity, Partnership, and Empowerment. And this is our attempt as a healthcare system, as a public healthcare system, as a healthcare system committed to the health of our communities, to address the non-clinical factors that influence the health of our patients and our communities. And we want to do this through, as the acronym would suggest, identifying opportunities, nurturing cross-sector partnerships, and ultimately creating empowerment for our neighbors and our communities to live their healthiest lives. Next slide, please. When we think about how we want to approach this work, we think about it in 3 areas. First, we want to think about what we can do to build healthy families and thriving communities. Part of the work here is to actually identify through screening what are the non-clinical factors influencing the health of our patients and our communities, so that we can identify what approaches, programs, and partnerships might be most beneficial in addressing those needs. Secondly, we want to learn from our work, both to educate ourselves as well as educate others as to what are effective approaches to address social determinants of health, what are effective partnerships. And finally, we want to research and evaluate the work that we do. As we stand up partnerships and programs, we want to start from asking the question, how do we know that this is effective? How will we measure it? And if it is effective, how will we scale it and disseminate the knowledge? So this is our 3-part way of approaching social determinants of health in the Institute for Hope: service, education, and evaluation. Next slide, please. And now Sue Fuehrer, my president of the Institute for Hope and my dear partner, is going to talk about some of the ways we've tried to put this into action.
Thanks, Jim. So at the Institute for Hope, we were busy before COVID, and we got even busier when COVID hit. And very proud of the work that Metro did. Metro was the first to stand up a hotline for COVID, and since between March 16th and May 30th, nearly more than 12,000 calls were received from 17 counties. We were able to, within a couple hours, establish 6,500 telehealth visits to screen patients that were symptomatic for COVID, and then followed up with just about 4,666 care coordination calls. Very important for the community early on. In particular, one day I think we received, more than 1,000 calls that day to help allay the fears of the people in the community with respect to COVID. And what we did, in addition to doing telehealth and addressing the clinical needs, we also addressed the social and economic needs of the patients, particularly those that had been quarantined. And here at the Institute for Hope, to date, we have made 702 home deliveries, and that includes boxes of food, cleaning supplies, over-the-counter medicines, and diapers, lots of diapers. So you thought there was a shortage of toilet paper? Well, if you were a young family, there was also a shortage of diapers in many respects. And really the goal of this was to keep people that needed to be at home. And so we worked very closely with many partners, including the Greater Cleveland Food Bank, to get these supplies to the home rather than ask any individual that was supposed to remain in their home to go out and put themselves at risk, or more importantly, put anybody else at risk. And in addition to doing just deliveries, we've done a lot of other things too. We've had 78 behavioral health telehealth visits, over 500 warm line calls for people that were feeling isolated, 63 faith-based comfort calls. And in fact, just last week, a woman called and asked one of the chaplains, "Hey, you didn't call me this week, where are you at?" So those have been very popular. And we're going to talk a little bit more about some of the resilience circles that we are doing. We have been screening for social determinants of health. We did 400 follow-up calls for people that we knew in advance of COVID that were insecure for food to make sure that they had food. And we did 700 follow-up calls for patients with severe isolation, again, identified before COVID. Food, as the result of MedWorks and the partnership with them, we were able to provide over 300 gift cards for hot meals to seniors at both Parma and in the Buckeye neighborhoods. We provided 96 meals for quarantine homeless at the hotels, and we're doing that again this weekend, so that'll be close to 200. And we're partnering with the Western Reserve Area Agency for meals for seniors that are not able to get out. I'm going to talk a little bit about digital inclusion in the future, but in the next slide, but we're really excited about that. In addition, we did 300 homeless care packages for the women and families at Norma Her, and just under 500 for the veterans, or there are veterans at Lakeside, but for all the residents at 2100 Lakeside. And Bernie Kerrigan is speaking tomorrow, so a shout out to her. We partnered with First Year Cleveland Moms and Babies to provide 80 new mom kits so that mothers that were at risk for COVID or had COVID went home with a complete basket of supplies so they didn't have to worry about shopping. So that was our COVID response, but our day job prior to COVID and all along during COVID is to really commit to screening for social determinants of health. And social determinants, those factors include food insecurity, social connection, intimate partner violence, financial resource strain, transportation, housing and utilities, substance abuse, digital connectivity, employment stress, and physical activity. And to date, in the last year, we have completed more than 10,000 screens. Very proud to hit that milestone, and we look forward to doing way more now that we've got our systems in place. So we are screening through MyChart, face-to-face visits, social care coordinators. And what is interesting is that 38% of the patients that we are screening reside outside the city of Cleveland, and 5% are outside Cuyahoga County. And just within the last 3 weeks, we have also started screening our employees, recognizing as a healthcare provider, many of our employees, particularly under COVID, are struggling with some of the social determinants, and we want to look to see how we can help our employees. So it's one thing to screen, it's another thing to do something about it. And these are the results from the 10,000 plus that have been screened. And as you can see, social connection prior to COVID is a huge risk. And so that is one of the things, as Jim said, you know, we are screening, we are educating ourselves and others, and we are measuring and we are evaluating. So social connection falls at the top, food insecurity next, physical activity risk, daily stress, transportation, internet connectivity, financial strain, and housing risk, and ending with domestic violence. So since data drives everything we do, we are really pleased to announce that just last week we contracted with a company called Unite Us, which creates a multi-directional electronic interface that will allow us to close the loop with community-based social organizations, allowing for real-time cross-sector communication. Isn't that a mouthful? But basically what that means is it's like a health information exchange between community-based organizations, social service organizations, potentially government organizations, and healthcare facilities, where if we are at the hospital and the social worker or a nurse or a physician identifies a need, you're a doctor, somebody walks in, they say, I'm homeless, I don't have any food, and you're trying to take care of their healthcare needs. How do you address housing and food while you're in a 20-minute appointment? Well, you will now be able to complete this referral that will go out, and any community-based organization, social service organization can see it, they can grab it, they can say, I'm going to act on it, they can then respond, and everyone in the entire network across the community is going to be able to see this. And you know, a couple weeks ago, we were having a conversation with folks at United Way, Nancy Mendez, Jen Kahn, and Ben Mladen, and Jen Kahn said, you know, we knew before COVID we had some opportunities for improvement and perhaps some weaknesses in our referral system, depending very much on paper, very much on phone. When everybody started working remote, huge gaps, huge holes, and she said, what a great opportunity if we could redesign our system across our community and get it right. So this is the first step, and we are looking forward to something that will be electronic, it will be efficient, it will be effective, and most importantly, it will be evidence proven, which will allow us to really look at the referrals, not just in quantity, but in quality of the referrals. What are we actually able to do amongst the different organizations working collaboratively in this community to really make a difference in the overall health and well-being of the patients that we serve. And as you saw, digital connectivity and inclusion is one of the stressors, right up there with social isolation. And one of the ways to get around social isolation is to connect. And so many may have heard Dr. Boutros a year ago at the annual meeting say that he was committed to increasing internet availability in the near West Clark Fulton neighborhood. And in fact, we are doing that because nearly 28% of the households in Cleveland do not have any home internet. Up to 50% of the residents have no broadband. And so we are proud to say that in partnership with many partners, to include Dollar Bank, Digital C, they're going to speak on Wednesday or Thursday, I believe, AT&T, CMSD and CMHA, we have lots of partners that we are going to provide subsidized internet for up to 1,000 households in the near Clark Fulton neighborhood. And we have divided them in coordination with Digital C. Again, this was all done pre-COVID, but implementing right at the right time. Scholars, which are those students. We need to certainly make sure now more than ever, every student has the opportunity to have internet to do their schoolwork. Strivers, who are those that are between 18 and 40 that are striving to go to school, take online classes, apply for jobs. It's really hard to apply for a job if you don't have a computer or access to the internet anymore. And then the last class is the seniors. And that is how can we really help with the isolation? How can we help them navigate how to speak with their families, mind games, ordering on Instacart. Snap just offered Instacart now. So how can we train those older older seniors to do better? And one of the other projects that we are working on, again, along isolation and digital connectivity and overall well-being, is Scranton Castle, which is a CMHA housing unit just down the street from Metro Health. We are partnering with Greater Cleveland Food Bank, MedWorks, Digital C, and CMHA to provide a whole host of goods on June 19th. MedWorks is going to provide a hot meal through Antonio's. The Greater Cleveland Food Bank is providing a box of shelf-stable as well as fresh produce to every one of the 161 units in the building. And we have nightlight, security information, financial security information, isolation activities that can be done. We're providing information in both English and Spanish for COVID-19 and 2020 census. We're offering information how they can get digital inclusion. They will be part of the group that will be subsidized, and the entire Scranton Castle has now been wired by Digital C for digital connectivity, low, affordable connectivity. And we are going to do the FDOH screening for every resident that's there, so that when we evaluate those results, we will be able to provide individualized, tailored responses along the social determinants of health for every resident in this unit. We know that 92% of the residents are in fact Metro Health patients. And so I had the opportunity to speak with Jeff Patterson just this past Friday, and he is really excited about this because our goal is to make Scranton Castle a pilot that could then be looked at across the CMHA housing units so that we can figure out how we can, help people connect with health, use their telehealth, get online education services, whether it be how to use Facebook, how to order food, how to do online banking. And we also have a Robert Wood Johnson Foundation grant pending to actually study through our WJF the outcomes of this. So it's important to do good, but it's also important to really see, are we making a difference? So that's one of the projects we've got going on. And of course, anybody that's watched TV and seen Kristen in the Muni lot, we know that food insecurity is a huge issue, unfortunately, in this community. And that, in fact, in Cuyahoga County, there are nearly 250,000 people, 18.6% of the population, that struggle with hunger or food security. And I can tell you, as we screen our own employees here at Metro Health, that is a major issue for our employees, too. So it doesn't mean just because you have a job, you have enough money to afford food. And we also know that quality food is necessary for good health and that we can measure the clinical impact. So we have strong partnerships with many. I'll let you read them. And we have lots of really cool programs that are going on too. VITA has been going on for a few years. It is really designed for our Latino population. It is faith-based, and we have hired professional chefs through foundation dollars, and they go to faith-based communities and they redesign recipes. So everyone from the community can bring in their favorite recipe that may include lard and all kinds of wonderful things that might taste good but aren't good for your heart, and we redesign them to make sure that they taste just as good but are a little bit healthier. We also have a food as medicine program, which is actually a prescription-based program for people that are at high risk. And we have a mini grocery store in our main campus, and people can come and shop and learn about healthy ways to eat. Obviously, COVID threw a little wrench in that. Nobody was coming on main campus to do grocery shopping. So we decided, okay, you can't come to the groceries. We'll make sure the groceries come to you and leverage telehealth to do those deliveries. And I had already mentioned SNAP can now be used for Instacart purposes. Very proud of our school health program. I admit I came from the VA after 35 years, didn't know much about moms and babies and kids. School health falls under the Institute for H.O.P.E., and I think it's really important. At Lincoln West, where we had school health, you can see that where there was a school health presence, the absentee days went from 15.97 to 7.8, almost cut more than half, and grade point averages went up a half a grade point by having a school health presence where kids could go to school and parents could feel that their students were safe if they knew that there was someone that they could go to if they had problems with their asthma or any other chronic disease. Open Table, I don't know if anybody's heard about Open Table, really proud. This guy in the picture is my Open Table member. He was homeless for more than a decade, and here he is helping put together the homeless packages that we delivered. And for anyone that is interested in a volunteer opportunity, I'm just speaking from my own, this has been an extremely rewarding way for me to help someone using my social capital and my relationship. So you have a table of 6 or 8 people. We're very diverse. We took on our table member. His big issues were socialization, and even during COVID, we have done a lot to make his life a lot better and been purposely getting him out and getting him walking. Been good for me too. And so if anybody's interested, you can see the Open Table information below. And then I just wanted to circle back to what Jim had started talking about. This is one of Metro Health's logos with respect to the heartbreaking effects of racism. One of the things that we are doing are resilience circles. And this is an hour-long session, no longer than an hour, where a small group of individuals can get together and have time and space to connect, recharge, and build resilience. We have been providing these through the Center for Health Resilience to several organizations over the last week or so, and getting very great feedback on the ability for people to speak, and most importantly, for people to listen and learn, and obviously overall heal. So if anyone is interested within your organization or your department, you can certainly schedule a resilience circle using the website link below. And last slide, just wanted to say, you know, we are doing all of this. It is really important for the overall health and well-being, but the reality is it has a serious economic impact too. And looking at social determinants of health and addressing things early rather than later, I saw firsthand when I had the opportunity to work for the Department of Veterans Affairs, where we had a capitated model, and we were able to address social determinants much earlier, much more upstream than in the hospital. And we know that in addition to providing improvements in employee and family health outcomes and engaging well-being engaging the well-being for our employees or for any employee, it also makes a huge difference in employee satisfaction and retention, which is measurable. And there are also measurable results in productivity, efficiency, and innovation. And we also know that social determinants of health and addressing them can decrease employee turnover, employee absenteeism, both of which are extremely expensive, on-the-job injuries, and then it does reduce the total cost of care and avoidable utilization, which is critical right now as we are stressing our healthcare system with access. So it's good stuff, it's important stuff, but there is also a very strong economic impact as to why we should all be very much interested in looking at the social determinants of health for everyone in our community. And with that, I would like to say thank you.
Thank you, Sue, and thank you, Jim. This is amazing work, and really appreciate all of your efforts and leading the way. We have a lot of questions coming in, and we're going to get right to them and get to as many of them as possible. To weave a couple of the questions together to get us started, there's some interest in partnering and finding ways to engage with your work. So volunteering, and some information was shared about Open Table as a possible way to volunteer. Michelle Seranian with The Gathering Place, and a gentleman named Josh Fishberg have lifted up and kind of noted some of the work that they're doing where there's intersections. And in your name of the Hope Institute, partnership is one of those. It's one of those 4 pillars. So can you talk about just some opportunities that exist and where people can go for that, and maybe even lift up as you have moved into your new space in Ohio City? There's a wonderful synergy and partnership with Urban Community School, and we heard from them not too long ago. So just want to explore some of the partnerships and opportunities for people to be engaged in your great work.
Sure. So Michelle and Josh, thanks very much for reaching out. Volunteerism has changed a little bit, and so we're actually working on some volunteer opportunities that can be done in a virtual way. If anybody wants to partner or connect, you can go to metrohealth.org and type I for Hope in, and it pops right up, and you can send an email, and it'll come to us, and certainly reach out. I know many people, those 2 people for sure I'm on LinkedIn with, so you can just send a message too. And Michelle and I have talked about some great work that we could do. And I'm going to let my partner Jim talk about Urban Community School, because he's got 2 kids that are graduates of that.
So our partnership with Urban Community School is really a way to tie in the community-based healthcare we've been providing with our school health program. We intend to continue to serve the community as we have for the past 25 and a half years out of the McCafferty building, but combine that with a focus on the students, faculty, and staff of Urban Community School, which is a very unique educational institution with a mission to educate the students of the Near West Side, and they are very deliberate in selecting their classes so that they reflect the racial and demographic makeup of the communities they serve. And so there's a real good mission fit there, and we're really looking forward with them as to how we can collaborate together in the future. We have some ideas about expanding a food as medicine program there, about integrating our school health program more closely with theirs. I saw a question pop up about immunizations. COVID has definitely decreased the percentage of children fully immunized against diseases. We're going to address this. This is where I think, to tie into another question, the hospital systems must collaborate to make this better, and we must collaborate with our city and county public health departments to address this issue. No one institution can do that alone.
Great, thanks. There's a couple questions to tie together here, specifically about the Unite Us initiative, and just if you could talk about some of the metrics that'll be available to collect that evidence. Will those results be used to expand the use of that, sort of a roadmap question related to that initiative? And then is there a guarantee that a CBO will be able to follow up with the client within a specific period of time? So there's a lot of interest around that, ability to gather data and kind of what that roadmap looks like.
I'll start, Jim. You can fill in. So first, we should say that we, in selecting Unitas, we did have a lot of work that happened at the community level, and folks from Better Health Partnership, United Way, the Center for Health Affairs, and Case Western Reserve sort of served as the convener for healthcare organizations and community-based organizations, and we evaluated several different products. So there was a lot of community discussion. The second thing I will say is that CBOs can use Unitas without cost. So that was one of the main criteria that we used, is to make sure that this would be free to CBOs. The third question was, how do we know if a CBO has capacity or not? And that's one of the beauties of something like this. If no one picks it up, at least we know no one can do anything about it, and that person doesn't fall through the cracks. And so, we have several different organizations that address food. If one plays Horseshack, I'm showing my age, I'll take this one. That's great. If no one does, then we know we need to go the next step further. And again, if someone does go Horseshack and takes that, we don't have the redundancy where somebody else is trying to do the exact same thing. Because what happens right now is often a patient has an issue, we give them a sheet of paper with a bunch of resources, and they start calling, and everybody gets caught up in the squirrel wheel, you know, and everyone's calling and there's phone tags. So the goal of that is to eliminate some of that to the extent possible. In terms of metrics, one of the reasons why we did like this vendor is because, one, it is agnostic to any electronic health record. So it doesn't matter what your EHR is in a hospital system, Unitas will communicate with that, and it feeds right into the EHR so that we will be able to marry the social service information with healthcare outcomes, which will really be powerful in the data and the metrics that we will be able to have access to and to evaluate, you know, is this making a difference? Because if not, reality is we don't have enough resources in this community to do some of these things, and maybe there are things that we should be scaling and spreading that are more effective and reduce some of the resources that aren't in areas that aren't quite so effective. And I don't know if I missed anything, or if Jim, you have anything you'd like to say.
Yeah, just to emphasize that one of the features of this network that we'll be able to build is that there'll be mutually agreed upon accountability metrics for everybody, and they will be transparent across the network. So I think it's holding ourselves and one another to higher standards of care and service for our community is one of what we're hoping the outcomes will be as we go down this road.
And this question may, in fact, be related to some of what you're discussing, but you know, a little forward thinking, recognizing that the impact of social determinants are generally not seen until years later. How will you track the success of the programs that you are putting into place?
This is the common dilemma that we look to our health services research colleagues to help us solve, because obviously we're a healthcare institution, and we have to keep foremost the question of how do we know that what we're trying to do in the Institute for Hope is actually going to improve people's health. I think we can look at certain things like, for instance, if someone has a chronic disease, is that chronic disease under better control? Are they able to access their medications and use them properly? We can also look at utilization. You know, if we provide effective services, are we helping people maintain primary care relationships? I'm a primary care provider. I believe very strongly that the continuity and accessibility of a primary care provider is key to someone getting effective health care. So are we actually encouraging people to form relationships with primary care providers and avoid the emergency department and avoid the hospital if necessary? So we can look at a combination of health metrics and utilization metrics to at least give us some idea as to whether we're headed in the right direction.
Great question here. You know, one of the great things about telemedicine is that it helped flatten the curve. But some of the collateral damage that is cited in this question is that vaccination rates perhaps dropped, and now we have COVID on top of everything. And the suggestion here, and then I can reframe it as a question, is, you know, can Metro use some of the infrastructure to do pop-up vaccination stations, you know, in terms of the recommended vaccinations that are needed? And, you know, I think, you know, within that question is the idea of, you know, what other innovative solutions or outreach are you considering as the Institute really, you know, expands its partnership and ways that you're interacting within the community?
Well, this is in the swim lane of our school health program, and we're really hoping to look at how we can use our school health program to improve immunization rates, even if schools are not completely in session or partially in session. But again, as I said before, improving the immunization rates across the community is going to have to be a collaboration amongst the healthcare systems in the city and county public health departments. It's too big of an issue for any one institution to tackle on its own. We
do have a mobile van, and the mobile van is going out. Our school health program has been very active in the summer feed program. Obviously, with kids not being in school, one of the major issues is making sure kids get good food. So we are working on, throughout the summer, having several events in local neighborhoods where people can come, and ideally the kids can get their visits, they can get their immunizations, they can get a backpack that may look different than what their historical backpacks have looked like, because they might be starting school at home in the fall, and you know, certainly have the information that they need for some of these things. We have also started with our school health program for the schools where Metro Health has a school health program, working on putting telehealth equipment in right at the school that could be used for both the school employees as well as the children that are enrolled. One of the biggest issues that we have, that, as Jim said, requires a lot of collaboration, is, you know, getting families to opt in with a Medicaid provider, and we don't care which of the 5 it is. But this gets sent out in every packet at the beginning of every school year, and we really need, as a community, to do a better job to make sure that parents recognize that their children can get and receive health care, but they need to opt in. And so that's one of the other major issues that we hope to work on this summer to improve for the fall, and will be a continued challenge if kids are not back in school session.
That's great. Just a final chance, I think, for either or both of you, just to say a final word about how we might support your efforts across the board and engagement with the community as we wrap up the Q&A time.
So you know, as many said, you know, we have a lot of partnerships. It is going to take all of us together working on these really tough topics. I mean, the reality is they are tough. And as someone pointed out, you don't see immediate results, and we're kind of an immediate result-oriented community, but they are important. And we welcome anyone. We look forward to partnering with people to do the right thing. And hopefully this is the long term. We've got kids that are being born, and Bernie's going to talk about first-year Cleveland, with really high mortality rates, and are really starting their lives way behind many other kids. And this is an opportunity to get it right and do right by these young children, to give them an opportunity. And that's, you know, what the work of the Institute for Hope is to give everyone the opportunity to live their healthiest life. And that includes lots of things besides just healthcare.
Great. Well, thank you both. Embedded in a lot of the questions in the chat, you'll see expressions of gratitude for the work that you're doing, and I really appreciate you spending time with us. I am going to turn it over to Marianne Crossley, who can close things out for us, give us a preview of the week that you have done an exceptional job setting up these important discussions. Marianne.
Thanks, Bob. Sue and Jim, that was fabulous. I mean, just I feel like I was drinking from the fire hose, just absorbing so much valuable and critical information. So thank you, as Bob said, for setting the stage for the week that's going to follow. These are issues where we can all roll up our sleeves and get involved, and you offered us plenty of opportunities to make that happen.